So ultrasound has been a cornerstone of diagnostics in rheumatology for the last 2 decades or even longer. And for this review, we decided to take a step back and look at the broad overview, broad but also critical, regarding the utility, the potential, and also the evidence supporting its use in rheumatic and musculoskeletal diseases, going beyond joints, looking at all tissues that are relevant for rheumatology. We explore not only, strictly speaking, musculoskeletal targets like joints, tendons, ligaments, or entheses, which have been the focus, particularly for the inflammatory involvement, but also structural damage in the last years, but also the emerging use of ultrasound for looking at vessels, vascular imaging, vasculitis, looking at salivary and even lacrimal glands, which are really tiny, but of course extremely relevant in Sjogren's disease, lungs in interstitial lung disease over a host of rheumatic conditions, and then skin and nail, which are highly relevant for skin manifestations, psoriatic arthritis, lupus, and systemic sclerosis. And all of these are relevant for our diseases. And beyond that, we also look at muscle stiffness and sarcopenia. We try to be as holistic as we could be. I'm not sure the word exciting is the best to describe this, but I think it was important for us to document or hallmark the fact that ultrasound has been here for a long time. Not everybody realized how much ground we've covered in terms of developing consensual, standardized, and thus ultimately more reliable and applicable systems, scoring systems and definitions for both clinical practice and studies, thanks to the efforts, among others, to the OMERACT Ultrasound Working Group and to EULAR. And so we now have clear scoring systems that are accepted by the community and work for synovitis, tenosynovitis, and enthesitis, again, where the early work focused. And these have been already tested in longitudinal studies and also in a few randomized clinical trials. And there are new scoring systems being developed which are not there yet, but are also either now already tested in clinical studies, where we also have a validated instrument, and these include large vessel vasculitis, gout, also CPPD, or salivary gland involvement in Sjogren's disease, which will hopefully, again, reach this point of validation in external longitudinal studies soon. So ultrasound is a radiation-free, dynamic, and more validated diagnostic tool than almost anything else. So it is also getting more accessible with every new generation of rheumatologists. We have a host of extremely exciting medications now for our diseases, but technologically speaking, diagnostically, rheumatology remains a relatively poor discipline. So ultrasound has been for the last 10, 15 years the tool of choice, again, particularly for the up-and-coming rheumatologist who, with the right training, can use it as a real-time extension of their hands. And it has, of course, great educational value also for rheumatologists themselves, but also for patients. It really makes a big difference if you're able to really show the patients what's going on under their skin. And of course, you can also use it to diagnose early disease, track flares, look at whether patients are still in remission, and also to guide interventions, infiltrations, biopsies, and so forth.